Epino, a world-renowned natural birth preparation and recovery trainer that helps in preventing tears and episiotomy during vaginal delivery and regaining pelvic floor strength during and post-pregnancy. About 85% of first-time mothers and 40% of second-time mothers have an episiotomy or a surgical cut in the vagina during normal delivery. This is because during the birth process, their vaginal opening is not able to stretch around the baby's head. This leads to either tears in the perineum or the need of an episiotomy by the doctor, which is later stitched back. An episiotomy can cause a lot of pain post-delivery, increase chances of infection, and have other long-term repercussions like sexual dysfunctions. In fact, WHO recommends episiotomy should only happen in 10 to 15% of all cases. Studies have also shown that massaging and stretching out the perineal muscles in the last 3 or 4 weeks of the pregnancy can help in reducing the risk of an episiotomy by making the perineal muscles flexible so that they are able to stretch around the baby's head more easily. In addition to this, most pregnant women also suffer from urinary incontinence during and post-pregnancy. This is mostly because their pelvic floor muscles have become weak during the course of pregnancy. Weak pelvic floor muscles are not able to control the bladder opening, especially when additional pressure is put on them while laughing, sneezing, or exercising. This leads to bladder leakage. Healthcare professionals agree that the best way to restore bladder control is a supervised program of exercises to strengthen the pelvic floor muscles. However, when it comes to exercises to strengthen the pelvic floor muscles, most women are not sure if they are doing them correctly since they cannot see these muscles. When it comes to perineal massage, most women are not comfortable or are not able to stretch their own perineum in the last few weeks of pregnancy. Epino is a clinically proven and well-established pelvic floor training device that serves the dual purpose of helping women stretch their perineum before delivery as well as strengthen the pelvic floor muscles during and post-pregnancy to prevent and treat bladder control issues. It consists of an anatomically shaped medical-grade silicone balloon attached to a pressure gauge and a hand pump. For the strengthening of pelvic floor muscles, the balloon is inserted halfway into the vagina. The woman then pumps a bit of air into the balloon to have something she can work against. This is the resting pressure. Then she starts the pelvic floor exercises by contracting her pelvic floor muscles and squeezing the balloon up to see that the needle on the pressure gauge goes up. To relax, she releases the pelvic floor muscles and the needle goes down. This biofeedback on the pressure gauge helps her understand that she's doing the exercises correctly and she's able to see improvement in the pelvic floor tone over time. She does this up-down training against the resistance of the balloon for 10 minutes daily. Starting week 28 of the pregnancy, the Epino can then again be used 6 to 8 weeks postpartum to tone the pelvic floor muscles back. After week 36, when it is time to prepare the perineum for birth, she keeps the balloon inserted and then starts pumping in air to inflate the balloon. She does it till the point she feels a good stretch in the perineum without feeling pain and according to individual comfort level. Then she keeps the balloon there for 5 minutes as she tries to relax and take deep breaths. After 5 minutes, she tries to relax the perineum completely to get the balloon to slide out in the inflated state. This action is simulating the expulsion of the baby's head during delivery and teaches the woman how to relax her perineum to help the baby come out. Once the balloon is out, there's a measuring template which can be used to measure the diameter of the balloon. When this stretching training is done on a daily basis for 3 to 4 weeks, most women are able to inflate the balloon gradually to almost 8 to 10 centimeters, which is equivalent to the baby's head. This in turn also helps in avoiding tears or the need of an episiotomy during actual natural delivery. In fact, multiple clinical studies globally have found Epino to improve incidence of an intact perineum by at least 48%, reduce rates of episiotomy by up to 46%, and reduce perineal tears by up to 42%. Epino helps expecting moms prepare both physically and mentally for a natural birth and recovery with minimal damage to their perineum.